Good morning. It's my pleasure to introduce you today to Kathleen Berlin. Sadly, as we know, our community is impacted by disaster. We've had tornadoes, major collapses of infrastructure, and certainly where we're positioned in HCMC as well. We are, as care providers, clinicians, physicians, in a position to be able to help when the unexpected happens or disasters strike. And so I'm really happy to be able to introduce Kathleen Berlin today. She's through the University of Minnesota, and she's going to be telling us about, what we can do in order to be part of the solution if something horrible happens. I know when the 35W bridge collapsed, I was at home thinking, that's where I work essentially, and how can I help? And I didn't really necessarily know how I could help. And so hopefully by the end of this hour, we might have some ideas about how to help if something like that were to happen, or when it happens. A little bit more about Kathleen Berlin. She graduated with a BS in nursing from the College of St. Catherine in St. Paul, Minnesota in 1981. Her professional career includes 15 years working in the capacity of a registered nurse at Abbott Northwestern Hospital, 5 years as a school nurse, followed by 2 years as a public health nurse in the emergency preparedness department of a local public health department. She served as the University of Minnesota Medical Reserve Corps coordinator since 2006 and participates on local, regional, and state level planning committees and advisory groups established to address public health emergency preparedness and response. And if this is an issue that you have particular interest in, Minnesota Psychiatric Society does have a subcommittee on disaster preparedness, and that might be an opportunity to explore as well. But for now, I will turn it over to Kathy. Thank you so much for joining us this morning.
Thank you, Kaz. First of all, I'll make a correction. I was listening to my own bio, and it said that I graduated from St. Kate's in 1981, which would make me 4 years older than I really am. So I graduated in 85. Probably means more to me than it does to you. I'm really excited to be here today to have this opportunity to talk to you about a program that is near and dear to my heart. Obviously, I've been coordinating the program at the university for 10 years, and this Medical Reserve Corps program provides its members an opportunity to be of service, as Kaz mentioned, to their community during a public health emergency. So I'm excited to get this information out to you. And I do know, I'm aware of one person who is a member of Ramsey County's Medical Reserve Corps unit. Is there anyone here that's registered with the universities? Great, yay. Okay, are you a med student or? Psychologist, great. It is, and we're going to talk all about it today, so that's great. That's great. From what I understand, the process is I'll speak probably tops for 40 minutes, and then we'll have time for questions. And the other caveat is I am from the East originally, so I feel like I talk fast. So I'm going to try really hard to not talk so fast. And if there is a question while I'm speaking, feel free to raise your hand. So this is what the next 35, 40 minutes is going to look like. I'm going to provide you with an overview of the emergency response structure on campus, which will in turn provide you with the context for which the MRC fits in campus behavioral health response. We're going to focus a lot on, we're going to give a brief overview of the Medical Reserve Corps program, and then we're going to highlight the behavioral health response strike team, which is within the Medical Reserve Corps program. And we're going to talk a little bit about mass casualty planning on campus. And this is something that we've been focusing on the past, I would say, 6 months, and we're going to continue to do so. Unfortunately, there are a lot of scenarios in which there could be a mass fatality on campus, and we'll talk about how the behavioral health response strike team would fit in that role. Okay, some of these slides are new for me, but I wanted to give you an overarching context so you can see where the Medical Reserve Corps fits in. The Campus Emergency Operations Plan is one of those plans, like 500 pages. Within that plan, the Academic Health Center Office of Emergency Response, and that's the office that I work in, and which the Medical Reserve Corps resides, has been tasked with several plans, and that one is the Health and Medical Emergency Plan, Infectious Disease Outbreak Plan, the Pandemic Influenza Response Plan, and the Mass Fatality or Casualty Plan. And I listed all the other departments at the university in which we work. So when a big event happens on campus, so for the smaller, I shouldn't say smaller, For the everyday health concerns, we have Boynton Health Service. They do a fantastic job of taking care of students and staff and faculty. At some point, if the event happens and it's beyond their capacity to respond, then that's where the Academic Health Center Office of Emergency Response comes in. We work with all these other departments, so the police, Department of Emergency Management. We go in and we kind of lead the response. And within that response, the Medical Reserve Corps is specifically written into that larger emergency operations plan. The reason that I bring that up is I want to make sure individuals understand that this is a program at the university that has some meat to it, and that we are written into the plan. So when something large happens, like a pandemic influenza outbreak, if there should be a mass casualty event, that's where the Medical Reserve Corps would be deployed. And we'll talk a little bit about this later, but we also have been deployed many times off campus. So I don't know if you have any idea what the Medical Reserve Corps is, but it's a national response system that supplements public health and animal health, and hospitals as well. The program is designed to identify, register, train, credential, and prepare health professionals and others in advance, and those are the key words, in advance of a medical or public health emergency or natural disaster. The Medical Reserve Corps actually came about immediately following 9/11. So what happened, and I think you're probably familiar with this, is that when the towers went down, health professionals by the hundreds and thousands showed up. So in this picture, you'll see we have these two people here running away, which that seems natural response. Maybe this is a physician. He's running towards. So that's what happened, is that nurses, physicians, psychologists, anyone who felt that they could help rushed to the scene, and without a system in place to determine that really is a nurse or that really is a physician, those individuals were sent away. So it was kind of like a disaster within a disaster. So they developed the Medical Reserve Corps system so that we could pre-identify individuals so that when something happens, that we can get people deployed right away. We also know that hospitals and public health departments will need additional staff during large-scale emergencies. An example of that is a pandemic influenza. Okay, so hospitals might need additional staff, and we would be able to help in that situation. Okay, before I move on, I'm going to kind of set a tone now for the Medical Reserve Corps piece. And Kaz kind of touched on this in her introduction. Let's say it's a Saturday morning and you wake up and you turn on the TV and you find out that there has been a structural collapse at the University of Minnesota. So there's most likely going to be a mass casualty event. I'm guessing that many of you here will be thinking, how can I help? Like, as Kaz mentioned, how can I, that's happening in my community. What can I do to help? So I want you to think about that as you consider possibly registering for either the University of Minnesota Medical Reserve Corps or another MRC unit around the metro area. You may want to help. And so this way you would be pre-registered, and you would be getting a text and a message from me immediately letting you know how we're going to be involved in the response. Okay, this is our Medical Reserve Corps structure at the university. And now you'll notice I go from the top down. As far as I'm concerned, this is it. This is it right here. This is the strength of our Medical Reserve Corps, our members. So I always put them first. We have a reputation, and I'll probably mention this again. We've been the most deployed Medical Reserve Corps in the state. They often come to us first. The state health department also comes to us, and communities do know about us. So we get requests. So this is what I think of as the strength, is our members. When you look at the collection of health professionals we have here at the university, it's quite amazing. We have a structure here which is not very common in a lot of Medical Reserve Corps, is that we've developed strike teams to better align with member expertise and interests. So let's say you are a psychologist. We have a behavioral health response strike team. If you're a veterinarian, we have a veterinary medicine response strike team. So you can be a part of the general membership, which is about 1,100, or you could say, I really want to be involved in veterinary medicine response. Okay, so you have a choice, and so you say that's what you're going to focus on. We'll talk a little bit about that later. We have team leads for each strike team because I coordinate the program, and I'm a nurse. I'm not an expert. I'm an expert on emergency response, I guess you could say, but I'm not a behavioral health expert. So we have these strike teams. We have 6 or 7 strike teams, and then we have team leads that really provide the leadership for that team. Then there's me, and then I have 3 other colleagues in the Office of Emergency Response that assist. And then we do have Dr. Brooks Jackson. So we report directly to him. So let's say I receive a phone call or I receive a request for our services. I have to go up the chain of command, and I send them an email. Sometimes we call them. A lot of times my supervisor will call them and say, Dr. Jackson, this is what's going on. Do we have permission to deploy the Medical Reserve Corps? So that's how that works. Okay. I love this photo. I think it's so beautiful. It kind of shows the breadth and depth of our Medical Reserve Corps. And if you'll notice, every person on there is smiling. So that's what it feels like to be a part of this program, where you can be of service to your community. So this is who comprise the different groups that comprise the Medical Reserve Corps at the university. So any student, staff, and faculty of the Academic Health Center is eligible to join. We also have Boynton Health Service staff, university student counseling staff, and a few other departments that we would allow the Department of Psychiatry that we would invite to join. So this program is not opened up to everyone at the University of Minnesota. We do have about 1,100 registered members, which makes us the largest Medical Reserve Corps in the state and one of the largest in the country. Numbers, really don't mean that much, and I'll say that in our case, it does. We have a lot of faculty and staff who have plenty of expertise and interest, and we're very unique in the fact that we are part of the university system. Most Medical Reserve Corps are based out of public health departments, so that makes us unique. And I personally really value the enthusiasm of the student members, and we have about 400. So that makes us really unique. And so we have med students, dental students, nursing students. It's really a great group. So I had mentioned that we have strike teams, and if you're interested in one, you can contact me, but we have a pharmaceutical response strike team that is led by faculty of the College of Pharmacy. We have veterinary medicine response team, which has been deployed. We have a logistics strike team that's very important. They help with all the logistical things. They'll set everything up, tables, chairs, signs, forms, everything that you need prior to deployment. And then they also are responsible for the care and feeding during a deployment. We have a personal protective equipment fit testing team. If we need to test individuals, we need to put N95s on everybody that's being deployed. We have a team that can do that very quickly and safely. And we also have an MRC leadership team, and I think that's really important because I use those individuals as a resource. So sometimes I'll call Dr. John Hallberg up, and I'll say, John, I have a question. What do you think about this? And he'll give me an answer. I have 3 of the leadership team members here. Wendy Lumen is School of Nursing, and Christian and Jen are College of Pharmacy, and they're part of the leadership team, and they're individuals I can go to if I need more guidance. And then we highlighted here the Behavioral Health Response Strike Team. And so that's what we're here to talk about, something that you, I think, might be interested in joining. The photo down here, I'll talk about, we'll talk a little bit about this in a few slides, but the photo down here is a photo of an exercise that we did last month for a family assistance center. And then we would set up a family assistance center in the event that there's a mass casualty event on campus. So we'll talk about that, but we did exercise that this past summer. Okay, remember the structure of the MRC. We have the strike teams, and then we have strike team leads. And they serve as a liaison between me and the behavioral health strike team, especially during deployment. So, for instance, we deployed our veterinary medicine response team to Iowa in response to some floods a number of years ago. And so the team lead was down there. I was in Minnesota coordinating it from afar, and every day she would call me or give me a written report. So that's kind of how that works. So I know what's going on. If they need any resources, if they need anything, they're able to do so. And then they also come up primarily with some of the strategy. Again, I'm a nurse. I can coordinate the overall response, but our team leads, we really depend on them to help us with the expertise. And then they oversee the team during deployments, drills, and exercises. And the pictured here is Ty Mendenhall. He is our behavioral health response strike team lead. We are looking for 2 more team leads. It's really important in emergency response, as you might gather, to have redundancy. So for all of our teams, we like to have at least 3 team leads, so that if one is vacationing, we have someone else who I can call upon quickly to take their place. So how would you be contacted for a deployment? Okay, let's say I get a request. It depends on the nature or urgency of the event. When the bridge collapsed, Ty Mendenhall and I were on the phone immediately with each other. So the team lead and I were speaking right away. We have a new system. It's a scheduling system. It's also a notification system in which I can send a text out to 1,000 people very quickly. And that text might say, there's been an event on campus, please check your emails for more for further instructions, or go to the website for further instructions, or please go to Shiftboard and sign up for a shift. So you might, most likely, now we're trying to do it with texts. Sometimes we send emails out. If it's something that we get a request from a community and it's 2 weeks out, then I have time to send you an email, okay? We'll talk a little bit about the Mrc Registry too. If you decide to join, you sign up for a registry, then I have your contact information. We do not share that information with anyone. So I have the capability, if something happens, to get a hold of you very quickly. I think this is really important. Are you required to assist when contacted? So let's say I send a message out to everyone on the behavioral health response strike team. So I'm targeting one strike team, and I say, this is an event that's happened. I need 20 behavioral health specialists or professionals. You do not need to respond. You don't even need to email me back and say, I'm out of town, I can't participate. You don't need to respond to me. You always have a choice. Okay, that's really important. And I will not call or text you and say, how come you're not here? You know, this is a volunteer program, all right? Now, before I move forward, I didn't put a slide in here, but I wanted to add, oftentimes I get questions about, it's a volunteer, so, you know, do I get paid? The answer is usually not. You won't not get paid. However, with some of the departments, and if you're involved in the academic health center in any capacity, oftentimes we do try to work with your departments so that you don't have to take vacation. And you do get paid. So for instance, and we'll talk a little bit more about this later, when we sent teams down during the Hurricane Katrina deployment, those individuals, those nurses, physicians, psychologists, they were paid. They didn't have to take vacation. But it's kind of a case-by-case basis and depends on where you work at the university. Okay? You do not incur any expenses. So let's say we send you, let's say it's not on campus, it's up north somewhere. Let's say we're helping in Duluth. We make sure that you have transportation, we pay for it, we pay for your lodging. Though when I say pay, sometimes it's pretty austere. You might be set up in a school auditorium or something, sleeping on cot. So we can't guarantee. When we sent the veterinary medicine volunteers down to Iowa, they stayed at a hotel, and we paid for all their food and gas, so you don't incur any expenses. And that goes across the board, students, staff, or faculty. Now, I have like 3 or 4 slides, as you can imagine, on liability issues. And normally, I read through all of them. You're going to have access to this PowerPoint. And we do have this in the handbook. So if you join the Medical Reserve Corps, or you're kind of trying to decide if you want to join the Medical Reserve Corps, you could go to the handbook on our website. It's the Mrc Handbook, and that'll let you know that state and federal statutes generally protect health and medical volunteers from personal liability, provided certain conditions are met, and they're listed here. Obviously, you are acting within the scope of assigned responsibilities. And the example I use is if we are setting up a mass dispensing site, we call them point of dispensing. Not sure if you're familiar with that, but in the event we have an anthrax attack, and we need to get antibiotics out to individuals very quickly, or let's say it's a vaccination, it's smallpox, and we need to vaccinate. If you're not a nurse, we do not want you to be giving a shot, okay? So that's what we're talking about, and I'm sure you know, within the scope of your assigned responsibilities. Okay, and this one is really key, so I will point this out. The volunteer is registered with, deployed by, and under the direction and control of a political subdivision and is considered an employee of that subdivision, okay? What that means is when the 35W bridge collapsed, there were some individuals who went down and self-deployed. I don't know if they were part of the Medical Reserve Corps or not, but even if they were, until we say this is a Medical Reserve Corps deployment, they weren't covered, you know, liability-wise, okay? So once I get permission from Dr. Brooks Jackson that's, yep, we can deploy, then you are covered, okay? And I think that's important for us, those of us who have licenses, that we know that we're watching out for liability. In addition, the university is insured through a general and professional liability insurance policy, which includes within its coverage registered volunteers, so it's registered, acting at the direction of the university within the scope of their assigned duties, okay? So we're gonna kind of focus our discussion now on the behavioral health response strike team. And the two tasks or charges that this team has is they provide behavioral health support to the general public or the target group during MRC deployments, okay? They also provide support to MRC members during and after deployments, because what we do know, and we learned this when we deployed individuals down to Katrina and Rita during the hurricanes, is that it profoundly affected those individuals in mostly really great ways. They came back saying their life has been changed. They were greatly impacted and really felt honored to be a part of that deployment. However, during some of those deployments, you do need support, and we have a system where we provide that support during the deployment, and then after the deployment, we oftentimes will contact the individuals, or we'll have group discussions where we bring people in and say, you know, is there anything that you need to talk about? So we don't want to leave you hanging. It's really important to us that we support our Medical Reserve Corps, our members. Okay, our deployments. I've mentioned this one many times. Our most ambitious and largest deployment to date is our deployments to Hurricane Katrina and Rita. We sent 3 teams down, and we partnered with Mayo Clinic, St. Kate's, Nahama, which is a Jewish disaster response organization, and a couple other organizations. So we teamed up, and we sent individuals down for two weeks at a time. So that was the commitment. Our general policy within our unit is we do not deploy you for longer than 2 weeks, okay? Since then, our longest deployment has been 3 days. And that was we sent individuals to Iowa and then up north. So that's how it went. So we sent individuals down, nurses, physicians, psychologists, EMTs. We sent some students, and I will mention, I think we have some students here, that for every deployment that we've ever had, we have deployed students along. So it's not one of those things you're going to join, and then faculty and staff are the ones that get deployed. No, we deploy our students, and they are supervised, okay? So 3 teams went down, and I love this picture too. I just love it, okay? Hey, they're in this, you know, in this area that's been devastated, with families in a community that's been devastated, and they're looking pretty happy here that they're down there setting up clinics, you know, on outside clinics to help the community. So I really like this picture. I think that might be Ty. So that was the behavioral health response strike team leader during that deployment. I'm going to stop here and ask if anyone has any questions, or maybe somebody went down to support the hurricane deployments. Okay, so it was a really proud moment for our university's MRC. We had been in existence for a few months when that happened, and now there's Medical Reserve Corps units all over the country. So the chances of that happening again, unless it was a very significant and large event, we may not travel that far. But because there weren't that many Medical Reserve Corps units, or ones that were could respond, that may not happen again, but it was a great experience. We had 1 or 2 of the teams that continued to get together every year in September to celebrate their experience, so it's super cool. The 35W bridge collapse. I was at home making dinner for my kids. When I started getting all these phone calls, I'm like, what's going on? They're like, are you okay? Were you on the bridge? And then I turned the TV and heard about the bridge collapse. So as I'm driving back to campus, I was talking to Ty Mendenhall, our team lead, and we had our team deployed within an hour and a half. So the bridge fell, and we had team members from the Behavioral Health Response Strike Team at Fairview Hospital within an hour and a half. Okay, so that's how quickly something like that works. After we had that initial response, they set up the Family Assistance Center. And I have actually, it's kind of out of sync here, but the Family Assistance Center is a safe location for families of missing persons to gather to receive information and support following a mass casualty event. So they set up a Family Assistance Center very quickly during the 35W bridge collapse. And then our Behavioral Health Response Strike Team also responded and provided support there. I tell this story often, and every time I tell this story, and it's been years since the event, I do still get choked up. Normally, I wouldn't be at the site of a deployment. However, during that response, they had this Family Assistance Center, and we had behavioral health staff there. However, family members were showing up with physical symptoms. So someone might come in with chest pain, and they realized, oh, we need physicians and nurses. We need a medical station here. So they called me. The city of Minneapolis called me and said, Kathy, could you get some Medical Reserve Corps members to come and staff a station? So I actually went to the Family Assistance Center to bring in the supplies for the medical station. And really, even that few minutes that I was in there, what a profound effect it had on me. I was really, I can never think of a better word to use. I was walking on sacred ground, and I felt honored to be there amongst families and my colleagues from Public Health and the Medical Reserve Corps who were there to assist these families. It was amazing. I have chills. It was an amazing experience. So this Family Assistance Center, we'll talk about that because we have plans for that here at the university. But the primary functions of a Family Assistance Center is we do assist with collect victim information to aid positive ID. So there is a process for that. We'll talk a little bit about that later. Death notification also may happen at a Family Assistance Center. Situational updates, so that's really important. So it's where families gather together at certain times, they'll be announced. There's going to be a family briefing at 2 p.m. today. So the families arrive, and then someone stands up and gives them an update. They've recovered 2 more bodies. There's still 20 missing. And then they might invite the police, the head of police to speak, or anyone else that has additional information. So that's what happens at a Family Assistance Center. I have to go back quite a ways, I think. Okay, so we'll talk, we'll talk more about a Family Assistance Center because we do have plans here at the university for that. As I mentioned, we do receive requests from outside the university community, and we had a connection with someone on staff, and I don't remember the department, that helped us connect with the North Minneapolis community during the tornado response. And so what we did there is our behavioral health folks went out to a church where the community members were gathering, and we sat and listened. Okay, so that's what we provided some support, whatever support we could to that community. And that again was so. As far as shifts were concerned, we would send out a message to you via shift board, and it might say exactly what you'd be doing, providing support at a local community church from 2 p.m. to 8 p.m. This particular deployment did occur in the evenings because that's when people were gathering. So we went to churches in the evening. So it might ask, are you available from 4 to 8 p.m. Tuesday evening? And then you would sign up for that shift. And you would get provided all the information you need. So if we had resources for the community, which we did, so resources for those community members if their house was really damaged, we would have those resources and also some behavioral health support resources. We got a call from a school district about when there was a bus tragedy, a bus accident. We went down and it was only 3 members of our team, but they provided support to the students and the staff of that school. So we're talking about scope here. Sometimes it is 2 or 3 members, might be for a day. It might be the whole team for 3 days to 2 weeks, or it might be up to 2 weeks, okay? And then we also were called to support the response during the Wabasha County floods. So that area was devastated with floods. The state health department, the Minnesota State Health Department, does now have a behavioral health response team. At the time, they were just starting that team, so they called us. So we were sent down, and I do believe they stayed overnight as well. The team stayed overnight for 2 nights, and they provided support to the community there. Okay, I will say that I've listed 5 deployments. This team has been deployed more than any other strike team in our unit. We do get called upon from around our little metro area, our state, and other neighboring states because they know that we are a resource that they can count on. Now, I'm not saying, there's public health departments all over the state and other states, and they do a really great job. And they oftentimes will have a medical reserve corps. However, sometimes they don't have enough. They need some more support, and that's when we're called in. So we're not taking place of these response programs that are already in place that meet day-to-day needs. No, we're not taking place of that. We just don't come in riding on a horse and say, we're here, we're taking over. We wait and we hear, oh, what do you need? We need 2 of your people to assist our people. So that's kind of how the Medical Reserve Corps works. We're really integrated now into the public health national system. They all know about the Medical Reserve Corps. There's Medical Reserve Corps in every state. In the metro area, we have one public health department or we have one MRC in every public health department. And I did want to stop and mention here too that there might be some individuals here in the room that are not eligible to join the University of Minnesota. If you work for Fairview Hospital, but you do not have any kind of association with the Academic Health Center or the Psychiatry Department, you may need to join another Medical Reserve Corps. So if there's anybody here and you would join the Medical Reserve Corps in the county in which you live. So if you live in Ramsey County, you join Ramsey County's Medical Reserve Corps, okay? If you have any question of whether or not you're eligible, feel free to talk to me after the presentation or email me or call me. I don't want that to be confusing. We also had a question from an individual here who is a member of Ramsey County's Medical Reserve Corps. And he asked if he should join the universities. And, there might be some who would say, no, you should just belong to one, because otherwise there's 2 Medical Reserve Corps counting you in their numbers. The way I look at it is, if you join the university's Medical Reserve Corps and Ramsey County's, if something happens on campus, you're going to be deployed. If you're part of Ramsey County's and something happens at the university, you probably are not going to be deployed through the MRC system, okay? So you can join 2. It is important for me to know that you're a member of 2 different Medical Reserve Corps. Okay, so we're going to focus on a scenario that, as I mentioned, our office, which is the Academic Health Center Office of Emergency Response, that we've really been focusing on probably for at least the past year, which is a mass casualty or fatality event. And unfortunately, we know some people say it's not if, it's when. I don't really look at it that way. I try to be the half glass full. But I do want us to have plans in case there would be a mass casualty event on campus. Okay? So we have very detailed plans. I mean, we're not complete, I would say. We're always working on them, but we have pretty detailed plans at the university for these types of mass casualty scenarios. So when we started planning for this, we were like, wow, there's 120, really, probably more total scenarios that could happen at the university. We could have a structural collapse in the summer when there's a summer camp with 6th graders, okay? So we have to think about that as we develop our plans. You can imagine if we had a structural collapse of Pioneer Hall and there were, dozens and dozens of 6th graders staying there, what kind of family assistance center would we be setting up? I mean, this would be pretty intense, and we'd need a lot of behavioral health support. Okay, so these are all the things that we kind of look at. Oftentimes, people ask me, "Well, what do you do for a living? What do you do?" And I say, "I plan for things I hope never happen," and that's really kind of how I look at it. It's important, I think, for people to know in the campus community and elsewhere that public health departments and police departments, as well as emergency management departments, are constantly exercising for these kind of things. We have been involved, so our offices have been involved in 3 exercises on campus. A couple years ago, I think it was, maybe longer, we had an active shooter exercise where they actually have students and people act, in that kind of scenario. And then what is the response? Okay, so we have this emergency operations plan. Remember that? We have a large emergency operations plan that campus administrators, they pick it up and they're like, okay, what happens here? And then they look at it and they say, oh, the Academic Health Center Office of Emergency Response can help us with this. The police are going to do this, and that's how it works, okay? But they did an active shooter, and we set up in the emergency operations room in our office. Also, kind of, it's more like a tabletop where you talk about, oh, if that happened, then this is what we would do. And so, as the Medical Reserve Corps coordinator, I was like, okay, I would be sending a message to these individuals very quickly, okay? And then at the same time, we might be determining if it was an active shooter and there were possibly many casualties, we would be saying, okay, we are going to have to set up a family assistance center because there's quite a few casualties, or we're anticipating that. So that was the active shooter. We also had a light rail explosion. Again, there's a possibility of mass casualties or mass fatalities, and we participated in that as well. More recently, and that's what this photo is about, we had the Reunification and Family Assistance Center exercise August 9th. So it was pretty large in scope. We had individuals from our Medical Reserve Corps primarily, our logistics team, and our behavioral health response strike team participated in that. And if you have more questions about that, I'll be happy to answer. It felt really great as a mother of 3 young, well, now they're not young adults, they're middle adult, like 20s. I remember when they went to college, and I know what it feels like. Your parents are sending their children away, and we want to have plans. Our community wants to take care of individuals if something should happen. So if, on an individual level as well as a professional level, these kind of things mean something, because we know that we have plans to help these students and anyone else in the university community should we be impacted by a mass casualty event. And here we are at the St. Paul campus. It's the continuing education building that's been identified as one of our sites. So we set it up, and here I'm giving a tour to the logistics team and the behavioral health response strike team, letting them know this is the family briefing room. These are notification rooms. These are interview rooms. That's how detailed our plans are. We know what rooms are identified and what function those rooms will have. I like to mention here, because sometimes it gets confusing when we talk about emergency response. We are not first responders. Okay, that's the police, fire. That's not us. So we don't go to the site. Okay, if there's something that happens on campus where there's multiple casualties, we don't rush to the site. Not even our nurses and physicians will do that. We wait, we get information, and then we find out, okay, this is where we're going to provide support. So we are not first responders. We really are what they're now calling the second response, okay? And we're going to talk specifically about our mass casualty victim and community assistance plan. And listed here are the goals of our plan. Whoops, whoa, that was fast. Okay, these are the goals of our mass casualty plan. And I've put a little asterisk by the functions of the Family Assistance Center, because if you decide to join as a behavioral health response strike team member, that's where you would be sent to the Family Assistance Center. So we do support the Office of Medical Examiner operations. We ensure that there's situational awareness information to the families. And we create a centralized and well-equipped resource for family and friends, so that families, if you're out east and your student here is at the university, that they know, oh, this is being set up. If they want to fly in, they know exactly where to go to get information. For those of you who like diagrams, this might help. A mass casualty incident occurs somewhere on campus. The survivors are going to be identified pretty immediately. Some of those will be going to the hospital. Most likely some will be coming to the university hospitals. And then there's those that, I don't know if you've ever seen coverage. I don't know what the time is here. Okay. I'll talk quickly. There is a point where you need to take the survivors and anybody who has a witness and you set them aside, you bring them aside and you ask them if they saw anything, what information they can provide. Then we have the family and reunification. So immediately we want to reunify whoever we can. If we can get families and friends united, we do that. And then the deceased obviously go to the morgue, and then we have a family assistance center, which is where we come in, which is where the Medical Reserve Force comes in. We went over this again, the primary functions: collect victim information, death notification, situational updates, and primarily behavioral health support. There are 3 primary behavioral health roles within a family assistance center: the family liaison, family briefer, anti-mortem interview assistant. And the reason I'm showing you this is because I want you to know that this is how deep we're going with our plans. And you, as a behavioral health professional, would fit into one of those roles. The family liaison is someone that as soon as a family walks in, they're assigned a family liaison, and that person stays with them through the whole process. We don't want families just walking around not knowing what to do. Family briefer provides the briefings every hour, every 2 hours, sometimes it'll be every 6 hours. And the anti-mortem interview assistant is the one that sits down with a form and asks questions. What were they wearing? Do they have dentures? Do they have tattoos? That kind of thing. So quickly, what would be your time commitment if you decided, this sounds like something I'm interested in doing? This merits my participation, either at the university or somewhere else. I have crossed that out because I consider this your orientation, so you don't have to view that online. It's basically me talking over a PowerPoint, which isn't quite, hopefully, it's not too boring, but we do ask that members attend 1 behavioral strike team meeting per year. We offer 1 in the fall, 1 in the spring. They're 1 hour in duration. They're 1 hour. We serve food. It's pretty decent meeting. And then we, to read the monthly newsletter, I send 1 out once a month. And then if you have time, you can participate in a drill. If you have interest and you have time. And then we have a website that you can go to as well to look at what's going on. So the next steps would be you can register for membership in the Medical Reserve Corps, or feel free to call me. Like if you really are like this, I didn't get enough information, or I'm not quite sure, please feel free to email me. My contact information is listed in the next slide. But this is how you register. And if you do register, and I guess I have one here, you get a t-shirt. So that's the perk. That's one of the perks, but you get a t-shirt and you get a badge. So you get a badge. This is legit. Okay? And then that's my presenter information. And I try to end this presentation with that photo. Because again, it really shows what it feels like to be a part of a program that allows you to be of service to your community during a public health emergency. I just love this photo. I think we're okay for time. We might have time for a few questions if you have it.
Time for a couple questions. I want to thank you for that presentation. And then just to kick things off, one question came to mind. Every now and then we'll hear of a school where there's been multiple suicides in a row, or some kind of public health emergency related to suicide. Has our U of M group ever been deployed for those kinds of circumstances, or how are those usually handled? That's
really a good question. And I failed to mention that on campus we do have the university, we have a small group, and I'm trying to find the name of that, University Community Response Team. So on campus, we have a team that's separate from the MRC that deals with student deaths, missing persons, and suicide. And that's a small group of interdisciplinary group who at campus would go and talk to, like let's say it happened in a dorm. So they would go and talk to them. That's separate. So that's smaller in scope, not smaller in need, smaller in scope. We haven't received anything about suicides. However, we could. That's the kind of thing where if there was a student suicide or multiple suicides, sometimes happens in a school district, that they would call the university and say, our counselors need help. And so they would call us, and we might send our behavioral health team over for maybe 2 or 3 hours during the day, or maybe more during the day. So that could happen. Good question. It's hard to anticipate when we might be called. Who would ever have thought that a bridge would have collapsed, you know? So I can't anticipate. All I know is I feel ready because of our members.
Questions?
Okay, I guess we need to get we're taping this.
Thank you so much for your presentation. I think I saw you present a while ago and signed up immediately afterwards and got your emails around deployment and wanted to go so badly to Katrina. but my husband intervened and said, we have 2 small kids, you can't go for 2 weeks. But I also had several psychologist friends tell me that I wasn't going to be adequately trained because I'm not an expert in PTSD and there's a risk of secondary trauma. So, but I have seen in following, as I sort of think of myself as an MRC lurker. I haven't done much, but I read and follow what you're doing. But I've seen that you've had a lot of training opportunities. I wonder if you could just talk a little bit about that for your behavioral response team.
Yes, really good question. We do offer everyone in the nation involved in Medical Reserve Corps and response really goes to psychological first aid. So it's like medical first aid. So we teach that. So this isn't a situation where you're going to go in and give in-depth therapy with someone. You're going to be sitting on this, maybe, on the side of a road somewhere, sitting down with an individual, and it's just psych first aid, just the immediate harm, what can you do to prevent immediate harm and long term. So it's not intense therapy. We do have some training in that, and I'm kind of looking for Ty to provide that. So we do have training. Psychological first aid is one, and then I forgot to tell you, we need to put this up on our website. We do have apps as well for responders. So we want to make sure that you do have the information to support you so that if you show up, one quick story during the Katrina response, one nurse wanted to go, but she knew that in her personal life she was dealing with some pretty heavy stuff, and she did a self-assessment, which we would ask you to do, that she didn't feel like she couldn't go, she could not participate. So really good question. We will not send you on a deployment unless we feel we have all the information you need. So during the floods, the Wabasha floods, when they were sent down, we gave them a situational update. We gave them tools that they could look at so they could take notes. So we provide, if you need to take notes and documentation. Does that answer your question? So yes, the training piece is really important. And sometimes we need feedback from our members like, I need more training on that. But we will, the apps are really good, and I'm going to go back today, make sure we have those on our website. So there's some self-care apps and other apps that you'll use when you're deployed. Really good question. And it's all free, and we always have food. That's, I don't know why I have to say that, but I kind of sometimes, that's kind of a pull for me if there's food.
The university pays for the food?
Yeah, our office does. I mean, it's like this, the Medical Reserve Corps program is really supported by the university. I mean, I think we have a history of community service at the university, and that's why I chose to work here, one reason. And so, yeah, they support the Medical Reserve Corps. You don't incur any expenses. We like to treat you well as best as we can because we appreciate your participation in this program.
Is there another question? I thought I saw another hand. All right. Well, thank you so much.
Thanks. And I'm going to stay here for a few minutes. If there's anybody that wants to come up and ask me a question, that'd be great. Thank you so much for attending today. Appreciate it.